Hi, my name is Stephen Duncan,
Hi there, my name is Rudy Fernandez.
and we are from UT Southwestern Medical School. The topic of our research project is the ear, nose, and throat burden of disease among Asian Pacific Islanders on Saipan.
One of the main reasons we chose Saipan is because it's so culturally distinct from the US, and in particular, there's a high incidence of betel nut chewing, which has been considered a Group 1 carcinogen by the World Health Organization.
So we were able to travel to Saipan this past spring just in the nick of time, and we conducted a retrospective chart review of all patients who saw an ENT provider within a 5-year range.
We had a total of 674 patients with a gender distribution of a 50-50 male to female. We had a quarter of the patients who were uninsured, and a fifth of the patients had multiple diagnoses upon presentation.
When we looked at the social history among adult patients, we found that just about a quarter had histories of drinking alcohol, 40% smoking, and just over half had chewed betel nut.
When we created a relative distribution of the different diagnoses by anatomical location, we noted that over 40% of the diagnoses were within the ear, and a little over 27% were within the oral cavity and the oropharynx.
When we took a look at that burden of ear disease, we found that it was mostly from an infectious etiology. Much of this ear disease was chronic recurrent otitis media and associated diagnoses such as perforations of the tympanic membrane and conductive hearing loss.
We also had a total of 72 head and neck cancers with a 2-to-1 predominance male to female, which correlated really well with the social history, and we found that it was statistically significant that men were more likely to chew, smoke, and drink.
When we took a look at all of these head and neck cancers, we found that many of them were diagnosed at a later or metastatic stage, nearly half at stage 4. We also found that the most common oral cavity subsite was the buccal mucosa and the tongue, which align really well with other betel nut chewing regions such as Taiwan, and which was dissimilar to the continental United States where the lower lip is the most common subsite.
So in conclusion, the Asian Pacific Islander population on the island of Saipan had a high predominance of ear and oral cavity diagnoses. And that could be due to a variety of factors, whether that be the high incidence of betel nut chewing, socioeconomic barriers to healthcare, or other cultural differences that were found on the island.
Thank you.
Thank you.